Representing Dr. Troy Sasse of Lakeside Medical Care, a prescribing marijuana physician.
Hi, Dr. Sasse couldn't be here today. He's spending the weekend with his family, but I am the office manager and patient care coordinator. What basically that means is I'm the one that you first speak to if you're interested in medical marijuana. I inform you of the qualifications, of the steps necessary that you would need to take to come into our office and speak with the doctor to qualify. So I have our website actually up here, as you can see, and I have brochures and cards if you want them. And like Jan said earlier about the qualifications that are listed here, and within, I would hope, on top of these, we're going to add chronic pain, which is very broad because you can have chronic pain for many symptoms. But within the next couple months, New York State will finalize that addendum and we'll be able to treat more patients. Because I see patients that come in like chronic pain, I'm like, what's your chronic pain cause from? And it's none of these symptoms, and it's saddening that they can't be qualified. So I would encourage people who are suffering from chronic pain to keep yourself updated. Keep yourself updated on the industry and how it's growing and what you can do, and be an advocate for yourself and continue to speak to your state legislators and to push this, because this is a wonderful industry that is helping so many people out. I speak to patients daily that say that this certification, being able to have the freedom to use it, has helped their quality of life so much. Whether it's like, I can get out of bed, I'm not stuck in bed all day. That's great for them. Or I can hold down a meal, and that's one of the things that we're trying to do to get patients and to help improve their quality of life. So when a patient calls or they contact us, we would ask that they come into the office with their medical records. For example, if a patient is suffering from something we see a lot is spinal cord injury, we don't need your whole medical history, but we want things that are going to certify you specifically. So if you have spinal cord injury, an MRI read, or list of medication from maybe your pain management doctor, or if you have IBS, having a doctor that treats you for it, because currently you are being treated somewhere else for it, getting your last medical records from them, and a valid New York State driver's license with your current address on it, because that's really important to us. We try to stay HIPAA compliant, and we're trying to follow every New York State rule to the T so that this program can continue and grow. So we're very strict on making sure that you have all the correct medical records. And once you do that, and you fill out, if you come into our office, we'll have you fill out a little bit of information about yourself, medications you're on, if you have any allergies, and the doctor will review your file. Usually if you bring your medical records and your driver's license in the same day, we'll be able to certify you the same day. We'll get online, put your information in, and the doctor will sign it, and you'll walk away with your certification, and you'll go home, and you'll go on your home computer and register online. We've actually had a couple older patients who are not very tech savvy, but we can also help you guys out with that. If you guys need to come in, we'll sit on our computer and try to help you register and try to be as efficient with it as possible. For new patients, we ask that the first visit is $250. Unfortunately, none of this is covered by insurance because of all the regulations and rules out there. But it's $250 for the initial evaluation, and the doctor will write you a certification for 2 months. After that, you'll see the doctor every 3 months, and it's $150 for that visit. And every single time you see him, we'll talk to you about how it's working for you. Is it improving your symptoms? Do you need a change in recommendation? So the doctor can make up to 3 recommendations. So a lot of our patients are doing a 20-to-1 inhalation, and then maybe a 20-to-1 vapor and oil, and maybe a 1-to-1 ratio. So it depends on your conversation with the doctor, what you feel most comfortable with, what you want. So it really is, our doctor tries to work with you in the best way possible to get you the best recommendation possible, and he has no problem if you speak to him and consult with him and need a changing recommendation, we can easily do that for you. It's just about making sure that there's a physician-patient relationship there, because we are trying to build that with you.
No, do you want water?
No, I guess, does anyone have any questions about this process, or any questions for me? I feel like I covered most of the basis. Yeah.
Is there anything specific to get the chronic pain to get passed? Is there actually legislation that's gonna be coming up in the?
Yes, so New York State, I believe on December 21st of 2016, released that they are adding chronic pain. On top of that, there's a 45-day public comment before they can add that to the addendum, if I'm correct. So we're still in the works of that. It's coming, we're just waiting for New York State to give us the okay.
It's on the state registry. If you really look, the proposed rule and the comment period ends in February. And so theoretically, if it goes through the comment period
So there's
appropriately,
no-
then, well, we could probably comment and say it's about damn time.
Yeah.
But,
Let's all do that.
What is the comment thing? Like, is there like a website where you can submit comments, or is it a call in?
it's a state website, and it's not.
It's
the-
usually by email, you have to contact
Yeah,
the
you can contact by email.
director,
but
by
it's
email.
not on the Department of Health website, it's on, I don't know, Secretary of State or something like that.
Yes.
And in my office, we see quite a few Dr. Sasse's patients. And just as he had said, there's usually 3 different recommendations. And Dr. Sasse has given us quite a bit of latitude as far as which one is best for the appropriate patient.
Yeah.
And that's what we do in the office, that we work with the doctor's offices out right on it.
Yeah, we work very closely with pharmacists to try to get the best care possible for our patients.
He's chiropractor? What does DO stand for again?
DO, it's just he still has a medical degree, he just went to a different type of schooling.
So he's not an MD?
He's not an MD, he's DO.
Okay.
Theo's doctor of osteopathy.
Yes.
This is a
Okay.
chiropractor, yes.
No?
Are there any further questions for me and Lakeside Medical Care? Anyone who wants a brochure?
But I do want
or
to
a card?
clarify that he's not a chiropractor.
Oh.
No.
DO is not a chiropractor?
No, he is a practicing family doctor. He can prescribe, he sees a lot of patients, he works in the ER, it's the same as an MD.
I
Okay.
stand corrected.
Yes.
Will he have PAs and nurse practitioners?
So right
also
now, it's a
under his
very
care?
small family business. It's the doctor, and 2 office managers, patient care coordinator. So we're still a very small business.
I would like some information on the card.
Yeah, of course, so
Would you
I have-
like to hand out some information?
Yeah, I have, cards